Introduction to Radiology, Medical Coding, Types of Healthcare Coverage. Welcome to Introduction to Radiology Medical Coding. Now it's time to dig into types of healthcare coverage. In this video, we'll see how coding connects to things like global packages, medical necessity, and the systems that keep claims accurate and compliant. This is where your knowledge gets practical. Let's dive in. Section 1. Types of healthcare coverage. Healthcare coverage generally falls into three categories: private insurance, government programs, and no insurance at all. Private insurance includes plans like Blue Cross Blue Shield. These can be employer-sponsored or purchased individually, and coverage varies depending on the contract. Government programs include Medicare and Medicaid. Medicare is for people 65 and older, those with certain disabilities, and people with end-stage kidney disease. It's split into Part A, hospital care, nursing facilities, hospice, and home health. Part B, doctor visits and outpatient care, both medically necessary and preventive. Part C, Medicare Advantage, combines Part A and Part B and often includes prescription coverage. These are managed by private insurers. Part D, prescription drug coverage. Medicaid is a joint federal and state program for low-income individuals, especially children and pregnant women. It varies by state, but follows federal guidelines. State programs like Children's Medical Services cover kids with chronic or complex health needs. These vary by state, but provide critical support. Each payer has its coding policies, but Medicare often sets the standard that others follow. Section 2. Global Package as defined by CPT. The Global Surgical Package bundles pre-op, intra-op, and post-op services into one payment. This applies to procedures done in hospitals, outpatient centers, or even offices. The global period can be 0, 10, or 90 days depending on the procedure. CMS uses standard global package definitions, but some commercial payers may have their versions. Always check individual payer rules when coding surgeries. Section 3. Medical Necessity. Medical necessity means a service is appropriate and effective for the patient's diagnosis. For Medicare, services must be reasonable and necessary under Title 13 of the Social Security Act. Medicare defines what's covered through National Coverage Determinations, NCDs. Local Coverage Determinations, LCDs, set by Medicare Administrative Contractors, MAC. LCDs may also include related billing and coding articles which list diagnosis codes that support payment. The claim may be denied if the diagnosis doesn't meet those requirements. Example, Medicare coverage and local coverage determinations for diagnostic chest X-ray services. What is this chest X-ray LCD about? This LCD provides billing and coding instructions for chest X-rays using 4 specific CPT codes. It is a reference tool that tells healthcare providers when Medicare will cover these procedures and under what conditions coverage may be denied. CPT and HCPCS codes. These codes describe the type of chest X-ray performed based on the number of views. These are the procedures eligible for Medicare reimbursement under this LCD, provided other criteria, like diagnosis, are also met. The LCD states, under the Social Security Act, Medicare does not cover any items or services that are not considered reasonable and necessary for diagnosing or treating an illness or injury, or for improving the function of a malformed body part. According to the Social Security Act, Medicare will not pay claims that lack the proper documentation needed for processing. The Medicare Program Integrity Manual requires that submitted claims include the appropriate diagnosis codes. How to use this LCD? When billing for a chest X-ray. Step 1. Choose the correct chest X-ray CPT code based on how many views were taken. Step 2. Check the patient's diagnosis. Make sure it is not one of the ICD-10 codes listed under the Do Not Support group on the LCD. Step 3. Ensure your documentation supports medical necessity, especially if the LCD itself includes a more detailed list of accepted or rejected ICD-10 codes. In these cases, providers should give the patient an advance beneficiary notice, ABN, to let them know they may be responsible for the cost. Commercial payers may have different definitions of medical necessity. They often publish their policies online or include them in provider contracts. Bottom line, if it isn't medically necessary and you can't prove it, it won't be reimbursed. Section 4 National Correct Coding Initiative, NCCI. The NCCI created by CMS prevents incorrect coding and overbilling. It includes 3 types of edits. Procedure-to-procedure edits block code pairs that shouldn't be reported together. A modifier may be needed to override an edit. From the ER example in Module 2, Section 5, a 1-view chest X-ray and a 2-view chest X-ray performed on the same day would be a procedure-to-procedure edit by adding the modifier XE to the 1-view chest X-ray. Each procedure-to-procedure edit includes 2 codes, Column 1 and Column 2. Column 2 isn't paid unless a valid modifier like 26 or XE is used and clinically supported. Medically unlikely edits reference a maximum number of times a service can be billed in one day. For example, some CPT codes can be only used once a day. Add-on code edits make sure secondary codes are only billed with appropriate primary procedures. Section 5. Governing organizations. Several major organizations guide radiology coding and compliance. American College of Radiology represents radiologists and advocates for reimbursement policies. American Hospital Association standardizes health data and supports ICD coding across hospitals. American Medical Association develops and updates CPT codes. Centers for Medicare and Medicaid Services oversees Medicare and HCPCS Level 2 coding. Department of Health and Human Services manages public health programs from vaccinations to disaster response. Office of Inspector General protects program integrity and promotes compliance. Centers for Disease Control and Prevention tracks disease trends and provides public health data. National Center for Health Statistics supplies health statistics to inform policy. World Health Organization coordinates international public health. Thanks for watching this introduction to radiology medical coding. To help you follow along and review what you've learned, I've created a free downloadable PDF with the lesson outline and key notes. Just click the link below this video to access the free PDF now. This resource is perfect for reviewing concepts, taking notes, or studying at your own pace. You can view it on my website or download the entire course PDF, which includes all 5 written lessons, each with detailed outlines and notes that match the video content. Links below. Don't forget to download it, and I'll see you in the next lesson.